As a stoma nurse, you'll be aware that coming to terms with a stoma can be difficult. And that's why Fittleworth asked me to create the Connections Toolkit, 6 tried and tested tools that help patients reconnect with themselves and their loved ones after stoma surgery. But it doesn't matter how good these tools are if you don't know how to introduce and explain them to your patients. So that's what this video series is for, a short explanation of each tool, how to recommend it, and how it might benefit your patient. Sometimes patients who've gone through a life-changing diagnosis and surgery struggle to identify and explain how they're feeling. This can be really frustrating for the patient and those close to them. The emotional wheel is a collection of descriptive words to help people acknowledge and communicate their emotions. You might suggest this tool to a patient if they're struggling to tell you how they feel or if they seem confused or overwhelmed. It's important, first of all, to reassure them that having mixed feelings is completely normal. Suggest that they look at the emotional wheel when they have a quiet moment at the end of a day, so they can reflect on how they felt by circling the words that resonate with them. Once they have the vocabulary, your patient may find it easier to talk to you and to their family and friends about how they're feeling, and to recognise for themselves if they need further support. A greater self-awareness can put them in a more positive frame of mind and speed up their recovery. When I've used this with my clients, they've said it has helped them to better understand what they're feeling and why, and to articulate what they need. More information about this tool can be found in the Fittleworth booklet, Connecting with Yourself and Others. It's important to remember that this and all the other tools are not guaranteed to fix your patients, but to support them on their journey and to give you some tools you can suggest if you notice your patient is struggling to cope. If you think they need more specialist mental health or crisis support, then always refer them to relevant services.